The focus of my capstone project was maternal mortality across the globe, as maternal mortality is a severe public health issue that impacts women, families, and children every day across the world. Different regions across the globe are impacted at different levels of this issue, and this research dove deeper into each area. This research was separated into three main parts, which are maternal death in developing countries, the comparison of the United States and other developed nations, and the disparities of maternal mortality in the US. For each segment, results and discussion were discussed, and lastly, recommendations were briefly touched upon. Most maternal deaths stem from preventable causes in pregnancy and childbirth. Maternal deaths do not include accidental causes, which could be car accidents or pre-existing health conditions not related to pregnancy. Maternal mortality is defined by the World Health Organization as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Causes may include hemorrhage, infections, eclampsia, unsafe abortions, obstructed labor, and many other complications that can happen in all different stages of pregnancy. Recent global efforts have been successful in declining the rates of maternal mortality, but the rates are still astonishingly high. This is due to developments in improved sanitation, increase in skilled professionals, and focuses on closing health disparities. It's been found that since from 2000 to 2020, maternal mortality ratio across the globe has decreased 34%, which in 2020, 800 women died each day due to maternal-related causes. Unfortunately, that equates to a death every 2 minutes. Even though there has been a decrease in rates across countries in the world, there still needs to be extensive work done to bring down the number of women that fall victim to this issue. This is hundreds of thousands of women dying each year to preventable causes during pregnancy. The highest prevalence of maternal mortality is found in low-income developing nations. 99% of all maternal deaths can be attributed to developing countries, which are characterized by lower educational attainment, poor economic output, poor health outcomes, social inequity, and poor environmental conditions. They typically also face poor water and sanitation, which are essential in fighting against infectious diseases and maintaining healthy lifestyles. Without proper support from a country's infrastructure, women in these countries are even more vulnerable to pregnancy complications and maternal death. These developing countries may even experience rates of over 1,000 deaths per 100,000 live births. A large issue in these developing nations is that many mothers in these regions struggle to obtain formal education due to inequities in access in these countries. Research found that 27% of the world's adults who are illiterate are found in developing countries. These nations are unable to support their population in receiving educational attainment. Many times, families cannot afford to send their children to school, or they have a complete lack of access to schooling. Within these countries, a vicious cycle is created, where parents do not attend school and now their children cannot go to school, and this will continue for generations to come. Without a lack of formal education comes with a lack of knowledge of family planning and contraceptive use, which leads to poor maternal health outcomes. Women become incredibly unequipped with the proper knowledge to support themselves pre, during, and post-pregnancy. Lack of knowledge leads to earlier marriage, higher rates of teen pregnancy, and higher rates of sexually transmitted infections, as women in developing nations are unaware of how to protect themselves in these situations. Also in developing nations, most time there's an inefficient healthcare system that does not serve the needs of its population. Many residents are unable to access any form of healthcare due to unawareness, but also the lack of services provided. With the lack of access will always come detrimental health outcomes to the whole population. Research found in developing nations with access to healthcare, many times the services were inadequate or poor quality, which still does not support the population. In Indonesia, where 90% of women receive antenatal care from midwives and 84% of women have a birth attendant at their delivery, they still have a maternal mortality ratio of around 175 deaths per 100,000 live births. Accessibility does not always equal equality, which is the fault of certain healthcare systems in these developing nations. In regards to the United States, the U.S. houses one of the highest rates of maternal mortality out of all developed nations in the world. In 2020, the rate was 24.9 deaths per 100,000 live births, where in other developed nations like Norway, Sweden, and the United Kingdom, their rates do not exceed 5 deaths per 100,000 births. The rates of maternal mortality also vary across different demographic groups in this country. It impacts racial groups, geographical groups, age groups, and groups of incomes at different rates. Maternal mortality is a severe public health issue in the U.S. because it is characterized by an inadequate number of appropriate medical personnel. Research found that the U.S. was incredibly lacking in these professionals, as they only have 12 midwives per 1,000 births and 15 OBGYNs per 1,000 live births. A lack of medical professionals will cause poor health outcomes and cause accessibility issues due to a small number of appropriate medical professionals. Also, the U.S. is one of the only developed nations in the world to not mandate paid family leave during the time of pregnancy and childbirth. Research found that paid family leave is essential to a mother's health, as women who had access to paid leave had a 51% decrease in the odds of being rehospitalized. Providing paid leave has been found to increase health outcomes for mothers, and it prevents them from coming back to the hospital with complications. Within the U.S., not every demographic group has the ability to access healthcare at the same level. The system is inequitable and does not equitably serve the entire population and provide the same health outcomes for all. Because of this system, many individuals must pay out of pocket for most healthcare services, which creates a cycle of debt and keeps disadvantaged individuals at a disadvantage. Geographically, different individuals also have different levels of access to healthcare, as different states have different requirements and eligibility for healthcare systems like Medicaid. An individual in one state may not be able to access healthcare that an individual in another state has access to. As previously stated, the United States houses different levels of maternal mortality for different demographic groups, the most staggering difference being in racial groups. American Indian and Alaska Native women in the U.S. face the highest burden of maternal mortality with a ratio of 119 per 100,000 live births. The next group burdened the most is non-Hispanic Black women, who face a ratio of 69 deaths per 100,000 live births. Non-Hispanic white women face a rate of 24 deaths per 100,000 live births. The differences in these rates is staggering and shows that the U.S. does not treat all racial groups equitably. Research found if Black women's levels of pregnancy complications were reduced to the levels of white women's, the maternal mortality ratio in the U.S. would decrease by 52.2%. Not only racial groups, but geographical groups and age groups are treated differently in maternal health. There's a large gap in maternal health outcomes for women living in rural areas and urban areas. Research found that non-Hispanic white women in rural areas had a 145% higher maternal mortality ratio than urban non-Hispanic white women. These rates show the lack of accessibility for rural women, and it is increasingly impacting their health just by living in a rural community. There are also incredibly different rates of maternal mortality for different age groups in the United States. The highest rates of maternal deaths are for women in their teenage years and for mothers aged 50 to 54. The U.S. does not treat all age groups according to the unique needs that they present during their time of pregnancy, and this reflects in the different rates for maternal deaths across different age groups. Maternal mortality impacts different regions and demographic groups across the world at different levels. Developing nations are especially burdened due to their poor quality infrastructure and economic status, which does not allow them to support mothers in all stages of pregnancy. Mothers are unable to attain adequate education and health services due to the structure of their country. This causes developing nations to have the highest rates of maternal deaths. The highest rates of maternal death was found in South Sudan, with 1,223 deaths per 100,000 live births. The lowest rates were found in Belarus, with roughly 1 death per 100,000 live births. Maternal death has slightly decreased for all racial groups in the United States except for non-Hispanic white mothers. Even though their rates seem to be rising, their rates compared to the racial minorities are still astonishing. Racial minorities still experience the highest rate of maternal mortality compared to the racial majority in the US. This is especially true for Alaskan Native American Indian women and non-Hispanic Black women. Within the US, southern states are burdened the most by maternal death, which could be attributed to the racial category of its inhabitants. Non-Hispanic Black individuals are more likely to live in these states, which could explain such high maternal mortality ratios. The southeastern region of the U.S. combined for a maternal mortality ratio of 48.7 deaths per 100,000 live births, while the northeast region of the U.S. had a ratio of 15.1 deaths per 100,000 live births. Again, rural areas have a much harder time of accessing health services compared to individuals in urban areas who are usually surrounded by hospitals and numerous offices. In these areas, there's typically not a specialized practice, and instead it is maybe occupied by a general emergency room or a general physician. Most of the time, maternal services can be found in urban areas, which could be over 50 plus miles from a rural community. This causes worse maternal health outcomes for women in rural areas, as there is a complete lack of access to maternity services. Based on the examination of current literature, there's a strong inverse correlations between maternal mortality and economic status, educational attainment, proper water and sanitation, and healthcare infrastructure. As economic status of a country or even an individual rises, rates of maternal death decreases, and this is the same for educational attainment for an individual. The better water and sanitation a country has, the more it can support its residents' healthy lifestyles, meaning there's lower maternal mortality in these countries. This is the same for healthcare infrastructure, as a great healthcare infrastructure is accessible, quality, and not costly to the individual. The health system and infrastructure of a country is a large determinant in maternal mortality rates, as well as the support given for pregnant mothers in all stages and systemic inequities, which has become very clear in the United States. The U.S. has such high rates of maternal death due to the lack of support for mothers in different stages of pregnancy and apparent systemic inequities, which causes higher rates of maternal mortality for racial minorities in this country. There is not a single recommendation that could be implemented across the globe that would immediately resolve the maternal mortality issue, as it is a complex and multifaceted issue and impacts individuals at different levels in different ways. For example, the United States is burdened by this issue due to historical systemic discrimination towards racial minorities, which causes them to be more vulnerable to maternal death. Without targeting this discrimination, this public health issue will long burden racial minorities in the U.S. In other countries, maternal mortality is an issue due to poor infrastructure and the lack of support for their residents. A first step that could begin to remedy this issue is to strengthen their health systems. Strengthening health systems will provide adequate medical personnel, more access to maternity services, and provide quality health education to mothers who may need it the most. With stronger health systems may come lower rates of maternal death. Thank you.